yet to open their account in the points table. Over in Group A, Napoli will host English Premier League leaders Manchester City. The Italian side have lost 1 and drawn 2 games so far, and they'll have to avoid defeat against Roberto Mancini's side, while City will look to extend their 9-game winning run across all competitions. They're absolutely on fire at this point in time. With that, it's an end of today's Sports Quarter. Hope you enjoyed it. Coming up next here on Headlines Today is Ground Zero, where we're going to tell you a horror story of deaths and blindings at government eye camps. Patients handed out expired medicines, outdated syringes, and callous negligence. Who's to blame for the loss of vision and lives? That's a special investigation story that's coming up next on Ground Zero.
रिक्शा चला रहा था, 50 साल हो गया, अपना परिवारों को पालता था। अब आग चले जाने से बेकार हो गया मैं।
घर में ना था, खाल दी तक खाऊं, नहीं दी तक पढ़ रहा।
4 deaths and 75 botched up eye surgeries in 4 months. The reason? Past expiry date medicines and criminal negligence of the doctors at the free medical camp organized by the Chhattisgarh government. Out of these cases, 12 cases are from Chief Minister Raman Singh's constituency, Rajnandgaon itself. The question then is, why is the state government not taking proactive measures to punish the guilty?
Headlines Today travel through Chhattisgarh's blind spots to piece together the story of callous neglect. We found out how the Health Department of Chhattisgarh methodically organized mass camps that blinded people where they were supposed to correct their vision. You're watching Ground Zero. I'm Rukmini Vishwanath. Straight to some breaking news coming in. Headlines Today's cameras capture the utter callous medical neglect in government hospitals and the camps. Elderly patients hoping to restore their eyesight encounter death and negligence at government camps. Camps were organized under the World Health Organization funded National Program for Control of Blindness, an unholy nexus of doctors, pharma companies and health officers operating in Chhattisgarh. Expired medicines, near expiry eye drops rob unsuspecting patients of their vision and their lives. Patients are being lifted off the streets so that doctors can perform operations to meet their set targets. All medical guidelines have been violated to perform quick eye surgeries in just 4 to 5 minutes. And if that is not enough, rusted scissors, infected syringes, dirt and garbage are being found at government hospitals. Well, the Headlines Today traveled through 3 districts of Chhattisgarh and found repeated evidence of negligence and apathy. Poor, helpless people who thought they had a ray of hope lost their vision because they could not afford anything better than a government-organized free eye surgery camp. Headlines Today's Neha Dixit gets us the disturbing details of how these free camps are conducted.
The Chhattisgarh government of Raman Singh organized 3 free eye camps at Rajnandgaon, Balod and Kanwardha. The camps were organized under the WHO-funded National Program for Control of Blindness. Hundreds of poor patients who could not afford the Rs 3,600 cataract operation got it done for free. But within a few months, the same patients are flocking to government hospitals, claiming that they have been cheated of their vision.
50,000 में मैं का जिंदगी करूं? आए अब ये मराग तो सबर दिन बाद चले गए, आए तो मैं का रोजगार करूं? अब काम में जी के रहूं, आए ये बैठे छल, पढ़े छल, तो मरना है जीना है, उमें मोर जिंदगी हो जाए। अब ये मोर आँख दिखत रहती, मैं कहूँ कर घिलार के मांग के घलो खा सकते हैं, यहाँ नहीं मिला थे पैसा कहूँ घा मिल जाती, तो ये जगह लेत में टरत नहीं तो मोर मुँह कौन पैसा डारी।
This is not just criminal negligence, but also the zenith of government's apathy. Instead of taking proactive measures to restore the vision of all those who lost their eyesight at the Balod Eye Camp, the government has washed off its hands by giving away Rs 50,000 as a compensation. Perhaps that is the value of a person's eyesight in this country.
Headlines Today found out that at these camps, expired medicine was used and patients who were unfit for surgery were operated upon. In Balod, 45 surgeries were botched up. Shashi Claudius, Block Medical Officer, told us how near expiry date medicines are bought by the health department at very low rates and how the officers in charge make money by passing it off as bought at full price.
ये बिल्कुल नहीं बोल रहे हैं। ये भी सितंबर एक्सपायरी की दवाई सितंबर माटी मतलब वो प्राइस से तो बहुत कम में उन्होंने खरीदी उस पे लिखा होगा ये ऑफर जी जी और उस पे लिखा 20 रुपए जी 5 रुपए में दे दी।
This was further confirmed when we met Sanjay Sharma, an executive of a pharma company. We said that we were from an NGO interested in organizing an eye camp.
जो हमारी कमेटी बनी है वो चाह रही कि ब्रांडेड कंपनी से ले और नियर एक्सपायरी में क्या रहता है सर कोई नहीं बता सकता है किसके पास कब कौन सा दवाई नियर एक्सपायरी में आएगी और नियर एक्सपायरी जब आती है तो कंपनी आना फाइनल में उसको बोलती है जिस रेट में क्योंकि ऐसे भी उसको फेंकना ही पड़ेगा तो चलो भाई जो मिल रहा है रेट।
Dr. Claudius also confirmed to us how substandard lens and medicines were bought for these camps.
क्योंकि वहाँ पे उन लोगों ने यहाँ से खरीदी है रेड क्रॉस से खरीदी ये मैंने पेपर में पढ़ा और इन्होंने कैसे खरीदा ये मेरे को नहीं पता नहीं तो अधिकतर हर चीज़ तो गवर्नमेंट से आती है। दूसरा एक हो सकता है कि लेंसेज इन्फेक्टेड लेंस भी इन्फेक्टेड हो सकते हैं लेकिन या घटिया क्वालिटी के इन्फेक्ट होंगे जो लेंस भी खरीद के आए होंगे मेरे को नहीं मालूम कहाँ से आते हैं ये भी मेरे को नहीं मालूम कैसे आते हैं परंतु यहाँ वो कवर्धा में भी इतने सारे हुए तो क्या मतलब ये भी कवर्धा में भी हो रहा है तो एक कारण है।
Pharma company executive Sanjay Sharma mapped the game plan of how pharma companies and hospital authorities connive to obtain substandard medicines at a lower price so that both parties make profit. Patient after patient at the 3 camps were treated with post-expiry date eye drops. Medicine that in many cases did not stop nor fight eye infection, but actually helped the infection spread. And so for the sake of personal gain, health officers, doctors and pharma company representatives blinded the poor patients of Chhattisgarh. Not just lost vision, 4 people also died. 65-year-old Urmila Soni was operated September 29th. Her daughter-in-law tells us the day after her surgery, she had major chest and stomach pain.
Urmila Soni's cataract surgery was conducted on September 29 at the Balod Eye Camp, where she was handed over this medicine with an expiry date of September 2011 to put in twice a day. Just 10 days after the surgery, she passed away at the government hospital in Raipur. The question is, why wasn't a post-mortem conducted to find out the reason for her death? With camera person Yogendra, this is Neha Dixit for Headlines Today.
Well, let me now go across to Neha Dixit, who joins us. Neha, that shocking report you brought us from Chhattisgarh. Tell us, who sanctions these eye camps and why is there no accountability pinned, considering it's a government-sponsored eye camp?
Rukmani, these camps are organized under the National Program for Control of Blindness, and state governments take the initiative to organize them. But what we found out is at these camps, a lot of money was made by the top health officers because they bought near expiry date medicines at a cheap price, and they charged the government by putting across the full payment. Apart from that, what happened was that the collector of each of these districts gave targets to these doctors to conduct the surgery, which is why each surgery was conducted in less than 4 minutes. Apart from that, what is important is because they had to meet the targets, they conducted these surgeries on people who were not even fit for it. For instance, they did not take the medical records, medical history of these patients. people who had diabetes, people who had high blood pressure were operated upon, who were not medically fit to be operated upon. Apart from that, the other provision that the government introduced this year was that each doctor will be paid per case, which is the government doctors were getting paid ₹50 per patient, and the private doctors, private surgeons who were hired for these camps were getting paid ₹1,000 per patient. So which is why they just operated people left, right and center without taking proper measures to ensure that there is no infection, to ensure that other things are also taken care of.
Neha, do stay with us. We will come back to you on the disturbing report that you have filed from Chhattisgarh. In fact, let's tell our viewers that while the government gets funds to treat the poor at free camps, Health Department milks these camps not just to pocket the money, as Neha was just telling us, but also to distribute strips of death in the form of post-expiry date medicines. There are some crucial questions in Chhattisgarh as elsewhere that need to be answered. Questions on how these free medical camps are run and to what purpose. Is this free death and physical handicap worth the cost in human tragedy?
In the past few months, Chhattisgarh has been actively organizing medical camps in various remote areas of the state.
We are in Bagbara, 100 kilometers from Raipur, where at least 400 patients from the nearby villages have come for a free medical camp. But unfortunately, in each of the department, we found expiry medicines which are being distributed to these patients, and the authorities are not ready to acknowledge it.
Rusted equipment, infected syringes and blood tests in the open were not enough. We found that DOTS, the medicine that was being distributed to TB patients, had already expired last year. Syringes that were being used for conducting ELISA tests to detect AIDS had also expired in July this year. Chemicals that were being used to conduct blood tests had expired way back in March this year. Headlines today also discovered expired surgical blades and injections inside the operation theatre. Patients who had assembled to get treated were ignorant that they were treading on the path of losing their health instead of restoring it. But authorities remained unmoved even on humanitarian grounds. Dr. Rakesh Palwal, civil surgeon, remained defiant and passed the buck even when he was presented with the proof by Headlines Today.
Dr. Kurvanshi is in charge BMO. He should know about this thing. It is not in my knowledge.
Dr. Palwal passed the buck but did not order that the distribution of post-expiry date medicines be stopped. Neha Dixit, Headlines Today.
And our reporter Neha Dixit brings us that shocking report all the way from Chhattisgarh. Let me go across to Neha now. Neha, tell us, what is the profile of the victims in this particular case? We mentioned at one point that the doctors actually picked up some of these victims off the streets. And how is it that expired medicines were used for treatment in this eye camp?
See, it's a free eye camp organized by the Chhattisgarh government, and these all the patients who come to these kinds of camp, most of them were farmers, daily wage laborers. So it can just be imagined that having them losing their eyesight, now they are struggling for survival because they obviously cannot go and earn their daily wage to survive. Secondly, what is important is that in front of our eyes, we visited one of the medical camps, and in front of our eyes, the doctors were distributing expiry date medicines. And when we asked them, they tried to pass the buck by saying that they are just there as consultants. So even pure practical logic was not applied.
All right, Neha, they say that there are none so blind as those who will not see. At least that seems to be true in the case of the state government there that has not really reacted to this horrible, horrible tragedy. But let's take a short break. Neha Dixit, thank you very much for bringing us that extremely crucial but disturbing report from Chhattisgarh. We'll take a short break. Coming up, callous disregard for patients doesn't end there. In a bid to meet the set targets of operating upon a stipulated number of patients in a camp, we found doctors indulging in practices that screamed of simple criminal negligence. More on that shocking story when we return. Stay with us. In 4 months, over 2,000 patients attended 3 eye camps in Chhattisgarh. Near expiry date medicines botched up several eye surgeries, robbing the patients of their eyesight and even their lives in some cases. Callous disregard for patients didn't end there. In a bid to meet the set targets of operating upon a stipulated number of patients in a camp, doctors indulged in practices that screamed of simple criminal negligence on their part.
Posing as a researcher, we met Prakhar Gupta, ophthalmic assistant at Kanwardha District Hospital. He told us how the targets were leading doctors to actually bodily lift patients from the streets.
आप एक कल परसों भर्ती किए थे को पंडरिया साइड का था, उसका उम्र 85-86 साल का था। उसका भी ऑपरेशन हुआ? उसका ऑपरेशन हुआ था, उसको उठा करके लाए थे। परसों भी उसको उठा करके लाए थे, है नहीं? इतना जर्जर स्थिति में था, वो कब टपक जाएगा उसको कोई कह नहीं सकते।
अच्छा ये बताओ, 85 साल के ऑपरेशन सक्सेस हो गई?
सक्सेस होता है, लेकिन हम वही चीज को मना कर रहे थे कि क्यों लाया जा रहा है। लेकिन यहाँ पर टोटल ये समझेंगे कि प्रशासन का डंडा चल रहा था, अभी टारगेट दिया गया। अभी देखेंगे पेपर में, आगे उठा करके देखेंगे, है नहीं? क्यों टारगेट दिया गया है, क्यों मजबूर किया गया है कि 1100 ऑपरेशन करना है।
Guidelines state that each such surgery should not take less than 15 to 20 minutes. And one surgical team should not be operating on more than 75 patients in one day. We calculated the results from Chhattisgarh. Roughly 300 eye surgeries were performed daily, which meant that each operation took an average of only 4 to 5 minutes to perform. The doctors had to meet their targets after all.
उनका फिक्स्ड रहता है डेट कि वो जिसका ऑपरेशन हुआ वो 3 को आता है, ऐसे करके तो उनको पता चलेगा कि इन्फेक्शन है। और वो अपने उससे जो जिन्होंने ऑपरेट किया, जो इस प्रोग्राम के हेड हैं डॉक्टर जोशी, उनको बता अच्छा ये इन्फेक्ट हो रहा है, मैं भेज रहा हूँ। उसके बीच में डॉक्टर जोशी,
कौन डॉक्टर्स थे ये लोग?
डॉक्टर जोशी, डॉक्टर मिश्रा और डॉक्टर मोरे।
तो डॉक्टर मिश्रा और मोरे डॉक्टर जोशी को बता रहे थे कि इन्फेक्शन हो रहा है?
ये लोग बता रहे थे, यहाँ से जो ऑप्थेल्मिक असिस्टेंट था वो उनको बता रहा था कि इन्फेक्शन है करके। वो लोग आके देखे भी, शुरू में वो लोग उतना सीरियसली नहीं लिए और दवाई देते रहे या जो भी रेफर करते रहे।
All those who lost their vision at the Balod Eye Camp were operated on September 29th. 65-year-old Mehran Bai is one such victim. Instead of operating her right eye, her left eye was operated. Now she has lost vision in both her eyes.
ये आँखें बढ़ा रहे हैं, देखा।
और कौन सी आपको कर दी है?
यही आता एला कर दिन है।
अच्छा, कागज कहाँ है?
कागज तो नहीं दे बेटी, हम ला जावा कह के गाड़ी में भर दी।
In these operations, the doctors also did not use a keratometer, a device that is used to measure the power of the lens required by the patient.
जैसे वो आप बता रहे हैं ना, क्या नापने वाले थे और क्या नहीं था?
लेंस के लिए तो कैरेटोमीटर ही चाहिए,
वो यहाँ है ही।
Even the medical history of the patients was not recorded. History of ailments was ignored.
ये जो रूटीन चेकअप होती है, जैसे ओल्ड एज है 70 एज में हो सकता है हार्ट की बीमारी हो, नाइटिस हो, कम से कम एक्सरे होनी चाहिए, ईसीजी होनी चाहिए। ऑपरेट है जो भी है, ऑपरेट केस मतलब ऑपरेट केस हो जाती है, ये सब नहीं हो पाती, इसमें प्रॉब्लम जाएगी।
ये नहीं हुआ था शिविर में?
Mukesh Bansal, District Magistrate of Kanwardha, denied all charges of targets being fixed, only conceding that the keratometer was not used.
My aim is that the people who are suffering from cataract and who are not able to afford private medical facilities, they can come to district hospital, because we have got 2 eye surgeons in the district hospital, so that they can be operated upon and they can be cured. So that was my only target. What I have been made to understand by the CMHO, that keratometer is available in the district hospital, but due to maybe some problem it was not working, and I was told that normally in camp standard lens only is given to the patient, and if they have problems afterward, they are given glasses to correct their vision.
While tossing the buck is the rule of the day, the truth is that some patients who went to these camps with the hope of restoring their vision are now struggling for survival.